Okay, so hello everybody. I'm Dr. Subrata Naskar, and I'm a consultant psychiatrist. I've been asked to talk about trauma of frontline workers and ways to reduce them during COVID-19 pandemic. So, as we know that COVID figures are rising day by day exponentially, and the worldwide impact of this crisis is almost comparable to a war. Medical staffs and affiliate healthcare workers are under tremendous physical and psychological pressure now. And for many nations, these kind of adds to an existing baseline psychopathology and also has led to a low morale in the healthcare sector. So, supporting the mental health of these individuals, of these healthcare workers, is a critical part of the public health response. So, now the question is how healthcare staff may experience stress during this pandemic. So, previously, there has been researches into the psychological effect of infectious disease breakout, like the SARS virus, like the H1N1 infection, and it has shown consistent pattern of reactions, and it covers the experience of staffs of the frontline workers, those in quarantine and those returning to work away from who have been away due to quarantine. So the challenges for most of the staffs, what they faced, these includes increased workload created by such outbreaks. Then there is this fear of contagion for themselves and their family members, of course. Also, this pandemic brings this experience of working with the new and frequently changing protocols, which adds to the stress. Then there is the usage of personal protective equipments, the using it, wearing it, and working in it is definitely very much stressful, both physically as well as psychologically. Um, Also, when you are caring for patients who are very sick and they're deteriorating very quickly, and you do not actually have proper cure, proper medication, all are kind of empirical treatment currently. So it also kind of adds to the stress of a healthcare worker. Also, there is this added stress at the same time of the health of the worry about the health of the colleagues who have fallen ill, who have fallen a victim due to this outbreak. So, in many cases, the resources will be stretched out to the limit, and difficult decisions has to be made about who is suitable for invasive treatment and such as life support and who is not. So, these treatment decisions will, in some cases, differ from decisions that might have been made where the disease is not so much virulent or the resources if it is greater presence in greater amount. So the gravity of the situation is well understood by most healthcare professionals, less so by the public, and this makes the situation very hard to adjust to. Family and friends may not be able to visit the patients, and staff often feel guilt that the patient has died alone. So definitely it is something you live with. So normal routines for breaking news of death are not available, and many time news has to be shared over phone. Equally, the opportunity to view the body and to collect the belongings is not being available for many families. So these are bound to create tension in the doctor-patient relationship that also adds to the stress of the healthcare workers. Many staff during this pandemic they had and all will contract the infectious disease. Those who have been exposed or those who show symptoms will require to go into quarantine. And research has shown that these staff who are who have quarantine experiences, they have this guilt about leaving frontline understaffed. Okay, so there is again fear that maybe their families will get contaminated from them. And also there is conflict about their roles as healthcare professionals, and on the other hand about being as a parent or a carer. So uh, there is this conflict that they have to deal with. while they're working as a frontline worker. So they also suffer from boredom, exhaustion, loneliness, especially as they usually work as a part of a closely knit team. So post quarantine, many of them may be anxious and reluctant to return to work. So the healthcare workers who are going through this day-to-day routine of their work, which is currently, as we discussed, is a bit different. Many of them may face many healthcare problems, and one of which is being acute stress reaction. In acute stress reaction, there are some physical symptoms such as palpitation, nausea, low appetite. Then there can be chest pain, abdominal pain. There can be headache, insomnia, and a state of persistent hyperarousal. There can be behavioral symptoms such as avoidance, behavior, recklessness, behavior, detachment, irritability. There can be increase in substance abuse, and there can be conflict with others, like maybe with co-workers or with family members. The emotional symptoms that we find in acute stress reactions, it kind of shows that there can be emotional numbness, there can be anxiety, low mood, anger, fear, mood swings, anhedonia, and lack of confidence. Acute stress reaction can also come with cognitive symptoms such as poor concentration, intrusive thoughts, flashbacks, poor memory, confusion, then hypervigilance, others. Apart from that, there can be moral injury. So, moral injury is present when there is a betrayal of what is right, either by the self or by someone in legitimate authority in a higher stake situation. At an individual level, clinical decisions will have to be made which contravene the morals of these who are making them. It will be essential for leaders at all levels to remind their staff that they are not making decisions alone. There is a protocol, and nearly everybody is following this protocol. And if something goes against it, something goes wrong, then you are not responsible for it. So that is the role that the leaders have to play over here, so that there is no moral injury in the team. Okay, so we are finding that there are a lot of healthcare workers who are developing PTSD, and hospitals are preparing for a magnitude more death of patients than usual, in addition to a very tangible threat of physical disability and death now faced by the staffs themselves and the families with the increasing rate of PTSD. So, apart from that, there can be other various problems and mental health situations, disorders that can be found in the healthcare workers who are working in the field day to day. So we are seeing in our practice day to day that the healthcare workers, they are also suffering like common people. I will say in a much greater magnitude, maybe from various mental health illnesses like depression. Definitely is there. Apart from that, anxiety disorder. Apart from that, psychosis is also present in many people. So, um, yeah, definitely, mental health disorders, mental health problems are rising in healthcare workers. So, what can be done to actually reduce it? So, first of all, there is certain role that can be done, that has to be played by the institution in which the healthcare workers are working. So, like drop-in sessions with psychologists or psychiatrists, it has been recommended based on evidence from previous outbreak. Uh, there often is dilemma present on the part of a junior doctor or the junior staff to visit a psychiatrist or psychologist, and it can be minimized by by their seniors. The seniors can lead by example by themselves dropping in for a session, and this will kind of increase the you know and this can in a way help the junior staff to break the stigma of it and to seek for help, while Peer support has its place. Sometimes being able to offload to a relative stranger can be useful to a staff, especially in order to acknowledge feelings that are struggling. They are struggling with, such as fear, anger, reluctance to come to work at all. So, what measures can be taken by support staff in quarantine? We can ensure that prompt testing of the staffs are done who are self isolating so that they are confident they are doing that appropriately. To reduce boredom, we can give people work to do, keeping them up to date what is going back in the hospital or at their workplace. This can also facilitate their return to work. We can encourage staff to create a exercise schedule coming down, uh, coming exercises, then grounding exercises, meditation, etc. Then to alleviate loneliness, we can help the we can keep the staff in touch with the teams and up to date with what's going on in the hospital to encourage them to contact with their family and friends. Then, if we find that if there is guilt present about leaving work short-handed and concerns about how they may be perceived by their peers, by their co-workers, so to address the guilt that they can feel about by leaving work short-handed, that can be addressed by addressing to the altruism they have while they're in isolation, so that uh, they have to understand that they have done their duty and in the line of duty they have faced this problem. They haven't done anything wrong, or they won't be seen as a person who have left their colleagues at their time of need. So we can offer them online support, phone support from a psychologist, and teach them stress management techniques. And we can consider putting them in touch with a survivor peer who can support and relate to them. So as we know that mostly healthcare workers, they work as a team. So what can teams do to a member? So there are certain roles that has to be played by a team leader. His main role is to communicate with the team members, and this communication need to be bi-directional. His role is to empower this team member because it may be necessary for the baton of the leadership to be passed between people during this marathon that is going on. And the leader has to be humane and humble to problems of other members also. In case of colleagues, what we can actually spot for any warning signs which might concern us, such as if they are talking about nightmares, if they are talking about difficulty in falling asleep, unable to stop worrying, if they are agey, jumpy, easily irritable, and they are having some medically unexplained symptoms, and also often flashbacks of stressful events, then definitely we need to tell them to we need to talk to them about it, and if required we need to motivate them to visit a mental health care worker. So offering them the opportunity to talk, we do not need to force them, but we need to make ourselves available to them, to listen, to laugh, or to cry with them. So what can an individual or we can do for ourselves during this time of pandemic to keep ourselves mentally healthy? It will be easy to acknowledge the gravity of the situation and to notice that whether we are in control of the situation or not. If we are finding that we are having certain symptoms which is not typical to ourselves, which is different from what I was previously, which is something new and which is distressing me, then definitely we need to seek for help. Psychological reactions to this acute and this prolonged stress at the same time, this is going to last, and this is doesn't mean that if we are having these symptoms that we are weak from our colleagues. It's not like that. So that we have to understand. So this pandemic is a marathon. It is not a sprint. It's a marathon. It's going to go on. So we need to take a break. We need to take time to reset ourselves. That's very important. So we also need to take time to rationalize the risk of infection, and also to make sure that my family feels comfortable that we are going to work. So reassure the families that we are taking every possible precaution to keep ourselves safe. Um, we also need to form a peer support network, and where external support is also present whenever required. And also, it is very important to feel proud that the work we are doing, and it's very important to understand that the role that we are playing for the society. So this should keep us going. This should keep you going, and you should definitely be proud of yourself. So nothing is permanent in this world, uh, not even our troubles, as said by Charlie Chaplin. So I hope that every one of you out there who is working the front line, keep safe, keep yourself safe, keep your family safe, and we have to do our work, we know, but also at the same time, apart from our physical illness, we need to keep our mental fitness to the optimum level, because as long as we are not mentally fit, we are not going to be physically fit. So thank you, take care, goodbye.